Hi everyone, welcome to today's session. If you or someone you love has been dealing with persistent high triglycerides and recurring episodes of pancreatitis, this video is for you. We're going to talk about a rare condition called Familial Chylomicronemia syndrome, or FCS, and how new treatments like Tryngolza are offering hope to patients. Let's dive in. Familial Chylomicronemia syndrome, or FCS, is a rare genetic disorder that affects the way our bodies process fats, specifically triglycerides in the blood. Normally when we eat, triglycerides are transported in tiny fat particles called chylomicrons. An enzyme called lipoprotein lipase breaks down these chylomicrons. But in people with FCS, a genetic mutation means this enzyme doesn't work properly, or it's missing altogether. As a result, triglycerides build up in the bloodstream, leading to extremely high levels, often over 880 milligrams per deciliter. Over time, this can cause serious complications. Let's talk about the symptoms of FCS. The most common and serious complication is recurring episodes of pancreatitis, severe abdominal pain caused by inflammation of the pancreas. Other symptoms can include fatigue, difficulty concentrating, often called brain fog, skin eruptions called eruptive xanthomas. These are small yellowish bumps, and in some cases, an enlarged liver or spleen. If you experience any of these, it's essential to talk to your doctor. Diagnosing FCS can be challenging, but it starts with 3 key steps: your medical history, lab tests, and genetic testing. Doctors look for recurring pancreatitis, a family history of high triglycerides, or specific symptoms like xanthomas or lipemia retinalis, milky blood vessels in the eyes. Blood tests check for fasting triglyceride levels. Levels persistently above 880 milligrams per deciliter are a major red flag. Doctors may also perform specialized tests to confirm the presence of chylomicrons in the blood, even after fasting. To confirm FCS, doctors may recommend genetic testing to identify mutations in key genes like LPL. This helps differentiate FCS from other types of high triglyceride conditions. Early diagnosis is critical to preventing complications like pancreatitis and starting the right treatment plan. Before diagnosing FCS, doctors must rule out other conditions that can also cause severely high triglycerides. These include multifactorial hypertriglyceridemia, uncontrolled diabetes mellitus, alcohol-induced hypertriglyceridemia, lipoprotein lipase deficiency, LPLD, and secondary causes. Multifactorial hypertriglyceridemia, a combination of genetic predisposition and lifestyle factors such as obesity, diabetes, and high-fat diets. Uncontrolled diabetes mellitus, poorly managed blood sugar levels can lead to extremely elevated triglycerides. Alcohol-induced hypertriglyceridemia, chronic or heavy alcohol consumption is a common cause. Lipoprotein lipase deficiency, LPLD, a rarer form of FCS caused specifically by LPL gene mutations. Secondary causes: hypothyroidism, kidney disease, or autoimmune disorders like lupus can contribute to high triglycerides. Through detailed medical history, lab tests, and genetic testing, your healthcare provider can differentiate FCS from these conditions. Certain medications can also lead to severely elevated triglycerides. If you're taking any of these, your doctor will assess whether they might be contributing. Steroids, such as prednisone or dexamethasone, estrogens and hormone replacement therapy, particularly in postmenopausal women. Beta blockers, certain types can increase triglyceride levels. Thiazide diuretics, commonly used for hypertension but may raise triglycerides. Protease inhibitors, used in HIV treatment. Antipsychotics like olanzapine or clozapine. Immunosuppressants, including cyclosporin and tacrolimus. Retinoids, often prescribed for acne, such as isotretinoin. If your triglycerides are high and you're taking these medications, consult your doctor to discuss alternative treatments. Now let's talk about managing FCS. Tryngolza, or olezarsen, is a new medication designed specifically for adults with FCS. It works by targeting a protein called apolipoprotein C3, which plays a role in keeping triglycerides high. By reducing this protein, Tryngolza helps clear triglycerides from the bloodstream. However, medication is just one part of the treatment plan. Lifestyle changes are equally important. Diet: stick to a low-fat diet with less than 20 grams of fat per day. This is essential for managing FCS. Alcohol: avoid alcohol as it can significantly raise triglyceride levels and trigger pancreatitis. Exercise: engage in regular physical activity as recommended by your doctor to maintain a healthy weight and improve lipid metabolism. Medications: Work with your healthcare provider to adjust or replace medications that may contribute to high triglycerides. With consistent use of Tryngolza and these lifestyle changes, you can significantly lower triglycerides and reduce the risk of complications like pancreatitis. Like all medications, Tryngolza has potential side effects. The most common ones are injection site reactions, decreased platelet counts, and joint pain. It's also important to watch for signs of an allergic reaction, such as redness, swelling, or difficulty breathing. If you experience these, seek medical help immediately. If you or someone you know has FCS, there's hope. Tryngolza, along with a low-fat diet, avoiding alcohol, regular exercise, and careful medication management, can make a significant difference. Talk to your healthcare provider to see if this treatment is right for you. Thanks for joining us today. Don't forget to like, share, and subscribe for more educational content like this. Take care.